with major cuts, the biggest thing is you got to stop the bleeding. And when you're out in the field, that's and if you have some of the the blood clotting powders or things that you can put in the wound, those are great. Even if you don't have that, if you're at home and you want something, flour or cornstarch, you can take that and put it in. It works wonders. You put it in there, put some pressure on it. The biggest thing is, if you don't have any of that, some cloth and pressure. And that's, the big thing is get something on there and put pressure on it and keep pressure on it. One of our tendencies, I think everyone's tendency, is put pressure on it for a minute and look. And, see if the bleeding stops. Well, you have to start over every time you do that. So you put it on, and I recommend you wait 15 minutes before you put it in. That means you got pressure on it. Because once it's, clotting, good clotting without some of those activators like you're talking about, takes a good 5 to 10 minutes to have a strong clot. So you don't want to mess with it with that. And when you're out in the field, sure you want to get the big dirt out of it, but I wouldn't spend a lot of time out there cleaning it out. Your primary thing is to keep blood flow from becoming a problem. So you want to get some pressure on it, get it wrapped up, and we worry about stitching up and when you get back. For a gunshot wound, the biggest thing is you got to stop the bleeding, and depending on where it is, as a general rule, if they get shot in the chest and you make it to them and they're still alive, you're probably going to be okay. That's what we've learned. If there's a gunshot wound that's in the chest and they make it to the hospital, probably everything's going to be okay. If it hits something vital, they're dead before you even get it. But hopefully most of them will just be BB wounds or something like that, where you just have to stop any bleeding and then get them to the hospital as soon as you can. But the bleeding is the biggest thing you got to do. So having things for big cuts to stop bleeding, I think the bandages, that blood stop powder if you have it, or even just flour, cornstarch. Those are some of the big things.
We have something called EMT gel, which is a collagen.
Yeah, that's great.
And it's really sticky, and when you put it in, it kind of grabs the thing. If you can get enough blood, blot it and do it quick.
Yeah, because if they're bleeding too much, it'll flush it out before it can do it. And one of the tricks to get it to work that we use in surgery is learning where the artery is that feeds the area that's bleeding, squeezing that artery off, blotting the blood off, getting the stuff in, and do that. So if it's a paw, you come up here and you're pressing on the artery, you stop it so the flow cuts down, or putting a tourniquet on real quick. Obviously you can't really do that very well in the ear or on the body, but you can slow the flow so you can get bandages and stuff on there. But the topical things like bupirosin ointment, the triple antibiotic ointments, still can work very, very well. One thing that with disinfected big wound, I think better than just about anything else is regular table sugar. You take a wound or an abscess and it's open, you pack sugar in there and wrap it, it will kill just about any bacteria that's in there without burning the wound, making it a problem. We've taken giant abscesses, opened them up, packed sugar in them, in 2 days they're all healed out without any type of antibiotics. Porcupines, there's no trick to them, there's no barbs on them, cutting the ends on the back, doesn't do anything. It's just like a needle jammed in there, you just got to pull it out. And it hurts coming out. If you can get them to go through the sedation, do it. And they come out much easier. We don't worry too much about infections. We worry about pieces left in. They usually have to work their way out, or we got to go get them. But how we handle it, as soon as we see them, we get them out of dope for it, and we go to sleep and pull them off. So if you're out in the field, right? So things that you can get over the counter things, just Benadryl. You can go up to 2 milligrams per pound of Benadryl, and that may slow them down enough. Plus, you can give them some aspirin to help with pain,